Congestive heart failure, coupled with fluid on the lungs, is a serious condition where the heart struggles to pump blood efficiently, leading to fluid buildup. Patients often experience a range of symptoms, including shortness of breath, persistent coughing, and fatigue, which worsen with physical exertion or when lying down. Swelling in the legs and abdomen due to fluid retention is also a common sign of this condition. Treatment typically involves medication to manage symptoms, lifestyle changes to reduce strain on the heart, and occasionally surgery to correct underlying issues. Risk factors for congestive heart failure and pulmonary edema include high blood pressure, coronary artery disease, and obesity. To understand the full complexities of these interrelated conditions, here's a look into the detailed aspects of the disease. Etiology, cardiac dysfunction versus pulmonary pathology. When discerning the etiology of fluid accumulation in the lungs, it's crucial to distinguish whether it's due to cardiac dysfunction, as seen in congestive heart failure, CHF, or a primary pulmonary pathology. In CHF, the heart's decreased pumping ability results in increased pressure in the blood vessels surrounding the lungs, leading to pulmonary edema. The fluid is typically found in the interstitial spaces and alveoli, presenting with symptoms such as dyspnea, orthopnea, and paroxysmal nocturnal dyspnea. Conversely, pulmonary causes such as pneumonia, cancer, or pulmonary embolism can directly damage the lungs' vasculature or lymphatics, causing fluid leakage. Here, symptoms may include focal lung opacities, fever, or hemoptysis, depending on the underlying pathology. Identification through clinical presentation, imaging, and lab tests is imperative for targeted treatment, whether it be diuretics and lifestyle modifications for CHF, or antibiotics, anticoagulation, or oncologic therapies for pulmonary conditions. Cardiovascular symptoms, decreased ejection fraction versus respiratory distress. Congestive heart failure and pulmonary edema often intersect clinically, presenting a complex diagnostic challenge. When the heart's ejection fraction decreases, indicating impaired contractility, blood tends to back up into the pulmonary circulation, leading to fluid accumulation in the lungs. This results in respiratory distress characterized by shortness of breath, especially when lying down. The nuanced interplay between cardiovascular inefficiency and respiratory symptoms is crucial for differential diagnosis. Management strategies and treatments diverge significantly based on the underlying condition, whether the primary issue is heart function or direct lung pathology, highlighting the importance of accurate diagnosis for effective disease intervention. Clinical presentation: peripheral edema versus focal crackles. Peripheral edema and focal crackles are clinical presentations that can differentiate between heart-related conditions and lung pathologies. In congestive heart failure, CHF, the heart's reduced pumping efficiency leads to fluid accumulation, presenting as peripheral edema, often noticeable in the extremities, such as swollen ankles or feet. Conversely, fluid on the lungs, or pulmonary edema, often results from acute lung injury or left-sided heart failure. It is characterized by focal crackles, the crackling or bubbling sounds heard in the lungs during auscultation, indicating fluid within the air spaces. Physicians use these signs, among other symptoms and diagnostic tools, to distinguish between CHF, which affects the heart's ability to pump blood, and conditions primarily influencing the lungs, directing appropriate management strategies for each. Underlying conditions: chronic heart disease versus acute lung injury. Congestive heart failure, CHF, and pulmonary edema, the fluid accumulation in the lungs, are intertwined, often presenting a diagnostic challenge. CHF is a chronic condition where the heart struggles to pump efficiently, leading to a backlog of blood and subsequent fluid buildup in the lungs. This can mimic acute lung injury, where the cause is direct damage to the lung tissue, leading to a similar fluid accumulation, but due to reasons other than heart function, such as trauma or infection. Disentangling the two necessitates careful clinical evaluation and diagnostic testing, as treatment strategies differ significantly. While diuretics and heart function support are mainstays for CHF, addressing the root of acute lung injury may involve antibiotics for infection or other targeted interventions. The accurate diagnosis is crucial because each condition can exacerbate the other, underlining the importance of nuanced medical assessment. Treatment focus, improving cardiac output versus removing excess fluid. In managing congestive heart failure, F, where fluid accumulates in the lungs, known as pulmonary edema, treatment strategies diverge based on the primary goal, enhancing cardiac function or eliminating excess fluid. Improving cardiac output often involves medications like ACE inhibitors and beta blockers to boost heart efficiency, alleviate strain, and decrease blood pressure. Conversely, diuretics are pivotal in removing excess fluid, quickly alleviating pulmonary congestion and symptomatic breathing difficulties. However, diuretics alone may not suffice if the underlying cardiac function isn't addressed. Therefore, treatment regimens are tailored to individual patient needs, meticulously balancing medications to optimize cardiac output while managing fluid retention to prevent respiratory distress.